Today we're going to be talking about muscles of the face and to some degree muscles of the neck. So let's begin with this muscle of the forehead. This is referred to as the epicranius muscle, and this is also called the occipital frontalis muscle because there is the insertion at the frontal region of the skull, and the occipital region of the skull would be the origin. Between the belly, which is the frontal belly, and the occipital belly is this large white sheath, which we refer to as a aponeurosis. So an aponeurosis is a tendinous connection between two muscle bellies. And indeed we see this quite well here. So that's the gallia aponeurosis of the occipital frontalis muscle, or epicranius. The purpose of this muscle is to raise your eyebrows, and so it wrinkles your forehead. Wrinkles the forehead. Let's take a look at another muscle here on the side. This is the temporalis muscle. The temporalis muscle has its origin in the temporal fossa, right below the temporal lines. And it comes down to attach to the coronoid process of the mandible. This is a chewing muscle. So when you open and close your jaw, this is the muscle that you're using, particularly for closing your jaw. The one that actually is the most dynamic for that, though, is this large chewing muscle called the masseter. The origin of the masseter is the zygomatic arch, and the insertion is the angle of the mandible. Again, this muscle is used for chewing, and particularly for closing the jaw. All right, now if we take a look here, let's take a look at some round muscles now. These are the orbicularis oculi muscle and the orbicularis oris muscle. The term orbicularis refers to the fact that the muscle fibers are running in a circle in both of these muscles. This particular one is going to help to close the eye. So this is a winking muscle, so to speak, right? So it actually helps to close the eye, the winking muscle. And then this one is going to be for making the letter O. When you say O, or even if you say orbicularis oris, you're using this muscle twice. So some people call this a kissing muscle. I'll show you a better kissing muscle in just a moment. Now let's take a look here at this muscle and this muscle. These are zygomaticus muscles. This is zygomaticus major, zygomaticus minor. The origin of the zygomaticus muscle is the zygomatic bone. The insertion, especially of zygomaticus major, is the corner of the mouth. So when this muscle contracts, the mouth, the corners of the mouth go up, and this is the smiling muscle. Deep to the zygomaticus muscles are the buccinator muscles, and so there's one on each side, one on the right side of the skull, one on the left side of the skull, so we're looking at just one right here. And the buccinator muscle is the big pucker muscle. This one actually helps you pucker as if you were eating a sour lemon. It's a deep muscle, again, to the zygomaticus muscles. Okay, let's take a look at this wonderful neck muscle. This is the sternocleidomastoid muscle. And this muscle is going to insert in the mastoid process. It's going to originate at the sternum and the clavicle, hence the name sternocleido for the origin, mastoid for the insertion. And notice when you have muscles that have the origin and insertion in the same name, the origin comes first and the insertion comes second. So sternocleidomastoid, right? Good. Excellent. This one helps to tilt the neck from side to side, or I should say maybe tilt the head from side to side, because your head is on your neck clearly. And so it's flexion, if you will, of the head.